welcome again, everyone, to our webinar, From Data to Action, Partnering with Governments on Evidence to Support Adolescents During the COVID-19 Pandemic. So today's event is organized by the Population Council's Girl Innovation Research and Learning Center, or the Girl, otherwise known as the Girl Center. And we are a global research center that generates, synthesizes, and translates evidence to transform the lives of adolescent girls. Through rigorous research about what works and what doesn't work, we aim to better direct limited resources to support evidence-based solutions that improve the lives of adolescents around the world. My name is Austrian. I'm the director of the Girl Center. I just started this role a little over a month ago. And as this is my first event, since I've assumed the role as director, I'm really excited because this event highlights an area of work that is both core to my philosophy of being a researcher, as well as one of the core visions of this center. So in our view, research that's conducted without a view for how it can be used to shape or improve programs and policies and the lives of those who are reflected in the data, in my view, shouldn't really be conducted. And that's why I'm so excited for today's webinar, because we're really highlighting two exciting partnerships between governments and Population Council researchers in Kenya and in Mexico. So we're joined today by colleagues and partners that have been leading crucial work that's been generating policy relevant data in partnership with government partners, and then together working in partnership to promote evidence-based policies and action, and even more so in these challenging times of the COVID-19 pandemic. So a little bit about how the webinar will run. We will start with two presentations from the Population Council researchers, and those will share the data of the recent studies that have evaluated and assessed the impact of the COVID-19 pandemic on adolescents. First, we'll hear from Dr. Beth Kangwana, who's the Executive Director of Population Council Kenya, and she will share findings from a recent report published by Kenya's Presidential Policy and Strategy Unit. And that report is based on research that the council did in partnership with this unit, otherwise known as PASU. Then we'll hear from Dr. Isabel Vietes, who is the Country Director of Population Council Mexico, and she will present the recently released evidence from the VOCIS 19 study in Mexico. Following those two presentations, we'll have a short Q&A for any questions that the audience might have related to those two studies. And again, you can just put your any questions along the way that you have in the Q&A, and then we'll go back to those during that Q&A section. After that, we will move to a panel discussion. And we are very lucky to have with us Julie Moabe, who is the gender advisor to the President of Kenya. And she sits at the Presidential Policy and Strategy Unit. And then we also have Guillermo Santiago, who is the Director General of the Ministry of Youth in Mexico. I'm really looking forward in a little bit to speaking with them about their experiences with these two studies, their perspectives on the government research partnership, and what we can continue to do to ensure that evidence continues to inform policies and actions in Kenya and in Mexico. After our discussion, there will also be another Q&A session where you'll also be able to engage with Julie and Guillermo. Okay, so let's kick off our program, and I am going to turn it over to Dr. Beth Kangwana.
Hello, everyone. So I shall be presenting on the social, health, education, and economic effects of COVID-19 on adolescents in Kenya. As Karen had said, I am the Executive Director of the Population Council Kenya office. Next slide, please. So in the early days of the pandemic, we started collecting rapid response data on adults to be able to generate data for the Ministry of Health. The Executive Office of the President had then asked us to widen the study to include adolescents and also to include more counties in the country. And the main objectives for this study, therefore, were to understand the socioeconomic, education, and health effects of COVID-19 on Kenyan adolescents, We also included gender disaggregated data from both boys and girls to effectively identify the gendered impacts. And then finally, we generated data to guide post-COVID-19 adolescent programming and policy in Kenya. Next slide, please. So we leveraged cohorts of adolescents and their households that we had established for various impact evaluations to be able to collect data on COVID-19. We have 2 rounds of adolescent and adult data in 4 counties, namely Nairobi, Wajir, Kilifi, and Kisumu. Round 1 was collected between June to August 2020. This is when schools were closed. And then round 2 was collected in February 2021 after schools had reopened. And you can see from this table, from Nairobi, Wajir, and Kilifi, we were able to interview just over 1,000 adolescents. And in Kisumu, we interviewed around 600 adolescents. So in addition to the quantitative data, which is shown in this table, we collected qualitative data through in-depth interviews with adolescents, parents, key stakeholders from these 4 counties, but we also included Kajiado County, Makueni, and Murang'a County. Next slide, please. So I'll take you through the results, but I'll give you basic descriptives where we're comparing the outcomes by a site and sometimes by age groups. And this is a very general overview of the key findings. Next slide, please. So just to set the stage of adolescents' experiences, it's important to note that the households they lived in experienced extreme economic shocks. So what we saw was about 85 of urban households and over 2/3 of rural households had complete or partial loss of income. And we see this on the panels on the left-hand side. And this was combined with increased cost of living. For example, the increased cost of food, which is the panel we see on the left, but we also saw increased cost of, on the right, sorry, increased cost of fuel and also transport. Next slide, please. In terms of mental health and food security, so in June to August 2020, when schools were closed, over half of adolescents reported experiencing depressive symptoms, and 70% reported skipping meals because of COVID. And this is the data presented from the green bars in the chart in front of you. The situation had improved somewhat by February 2021 when schools were open, and what we can see from the blue data, from the blue bars, is that there was a decrease in the percentage experiencing depressive symptoms and also skipping meals. And we see that this was largely driven by those adolescents that returned to school. For example, among those who did not re-enroll, we saw that 50% was still exhibiting depressive symptoms in round 2, which is similar to how it was when schools were closed. Next. Sorry. So I'll just, go back by 1 slide. Yeah, so I'll just read some quotes from some of the samples. So an adolescent girl in Kisumu said, up to now, my parents cannot get money at all, so we cannot eat what we used to before the coronavirus. Sometimes we end up eating little food since there is no money to have a balanced diet. We just eat whatever there is. And a father also was quoted saying that being at home with her now, with no work, has affected my daughter, because once there is no job, there is no money. Even eating has been a problem. You find that she can take back black tea the whole week, and we would not do that in the past. Next slide, please. So we also looked at education. So during school closures, adolescents were able to access education. However, they did experience several challenges. What we saw was 80% of the students we interviewed were able to access some form of remote learning during the school closures, but they faced different types of challenges or constraints. And these included limited access to reading materials, So 68% of students reported that they only read the books they had during school closures. And what we saw was that in low-income areas, a lot of students did not have any additional reading materials that they could access from the schools or public libraries. We also saw limited time to engage with education. So adolescents reported that they spent on average around 2.5 to 3 hours on education per day. However, we feel that this is likely to be overreported due to desirability bias. And we also saw that the home environment, especially for girls, was distracting them from remote learning. And then finally, we saw another barrier as limited access and agency to access online resources. So many students cited the inability to access phones for online learning, and only 32% of interviewees reported accessing phones. So even those who had access to phones struggled with accessing electricity to charge the phones. They didn't have access to data bundles, so which would allow them internet usage. And they also had limited agency to be able to access these resources. Next slide, please. In terms of re-enrollment, of those who were in school in March 2020, 84% of girls and 92% of boys were re-enrolled, and this translated to over 125,000 boys and 250,000 girls who had dropped out of school. So what we saw was the main barriers for being re-enrolled back into school was school fees, and this was reported in 47% of girls and 21% of boys. The next reason for not being able to re-enroll back into school was pregnancy for girls, which was reported in around 10% of the sample, and work for boys, which was reported in 14% of the sample. Next slide, please. We also saw that adolescents skipped healthcare in the past month, and the main reason for skipping healthcare was cost, and this was followed either by lack of services or medicines, or fear of being infected by COVID-19 infection if they were or accessed a healthcare facility. Next slide, please. So adolescents also reported encountering increased emotional, physical, and sexual violence acts. For all reports of violence, we saw that around half to 3/4 said it was happening more during the COVID pandemic when schools were closed than pre-COVID-19. We did not see any gender gap for reporting experiencing emotional violence. We saw physical violence being experienced more by boys than girls, and sexual violence was only reported by girls. Next slide, please. Regarding pregnancy and marriage, among girls who were 15 to 19 years old, around 4% were pregnant or recently had a baby, and this was translated to over 100,000 individual adolescent pregnancies. So of those girls who were currently married, what we saw was 32% got married after COVID-19 started. We also saw 44% got married because they got pregnant. 24% said that it was not their choice to get married, and 16% reported that they would have not been married if COVID-19 had never happened. Next slide, please. So then I will now take you through the recommendations based on an overview of the data that I've shown you, but we also have a more comprehensive report on all the data that's available. So once we had the data, the PC team, together with PASU, came to develop evidence-based recommendations that could be taken up and owned by the government. So I'll very quickly go through the recommendations, but later on, Julie Moabe from PASU will go into the recommendations in more detail. Next slide, please. So there are 6 recommendations that I shall cover. So the first was to raise adolescents' voices by supporting their participation in all public decision-making through the COVID-19 response, recovery, and also beyond. The second recommendation was acting to address immediate and ongoing risks in gender-based violence, which was exacerbated by COVID-19. The third recommendation was to establish a national multi-agency adolescent task force whose mandate is to develop a framework for an integrated multi-sectorial adolescent resilience and development strategy. Next slide, please. So then the fourth recommendation is to establish county adolescent multi-sectoral working groups whose mandate is to develop context-specific integrated county adolescent action plans to oversee implementation, monitor progress, and also to report back. The fifth is to use data and evidence at the county and national levels to guide development and prioritization of activities for adolescents, and finally to invest in adolescents with new and not repackaged investments to prevent the worst outcomes of COVID-19 for adolescents. And one example is to involve leveraging on technology supported learning to be able to improve equity in education and close the digital divide, and also provide financial assistance to support development of national policies. Next slide, please. So in terms of dissemination and next steps, PASU published the report, which is the image that you're seeing in front of you. It's called Promises to Keep. And this report was published in July 2021, and it has details on the data that I presented and much more, and also recommendations in much more detail. We are also working on publishing some papers and a book chapter using the data with continued support from PASU on additional dissemination products. So one example is that we've recently published a paper together with Johns Hopkins University colleagues, and this was a mixed method study to be able to understand how COVID-19 affected girls and young women's relationships in Kenya. And then finally, the team recently received funding to collect a third round of data, which will take place next year. Next slide, please. So I want to thank you for your attention, and unfortunately, I will have to drop off soon after this my presentation, as I have another engagement, but I shall hand over to Dr. Tim Abuya, who is a co-investigator on the project and will be providing answers in the Q&A session. Thank you very much.
Thank you, Beth, for that great presentation. You know, I think it's interesting. It really strikes me how it seems like every aspect of these adolescents' lives were affected in some way by the pandemic. And then you see that translated into the recommendations made by PASU, that they were not sort of single sector recommendations, but thinking about what can we do as a government to holistically see the adolescents and all of the different issues that face them and support them during these times and as we hopefully recover from the pandemic. So thanks again, Beth. And next I'd like to welcome Isabel to present on the VOCIS 19 data. Take it away, Isabel.
Thank you. Thank you so much, Karen, for the introduction. To start, I would like to thank everyone in the audience for taking the time for being here today. I also want to acknowledge our previous presenter, Beth, for her insightful presentation on the work of the Population Council Kenya, and also give thanks to our two government partners, Julie and Guillermo, and team. Without their administrations and active interest and support and participation on these two projects, we wouldn't be able to conduct these studies. At this time, I will be switching to Spanish for my remainder of my presentation on the Mexico office's study, Violence Outcomes in COVID-era Study, Voces 19. So I will present the results of the first round of data collection, and I will switch now to Spanish. The next slide, please. Pues el estudio Voces 19 tiene como objetivo establecer una corte de adolescentes y jóvenes adultos para saber cuál es el impacto que está teniendo la pandemia de COVID en la experiencia y percepciones de violencia, al igual que en otras dimensiones sociales, económicas y de salud de sus vidas. Al momento en que hicimos esta encuesta no contábamos con una corte preestablecida, como fue en el caso de Kenia. Iniciábamos este trabajo y, como ustedes saben, pues las medidas de distanciamiento social no permitían hacer el levantamiento de este estudio de manera presencial. La encuesta se hizo por vía digital a través de la plataforma SurveyMonkey. Fue una encuesta que se hizo a nivel nacional. Se inició la recolección de datos entre noviembre y febrero de 2021 y fue una encuesta dirigida a adolescentes entre 15 y 17 años y adultos jóvenes de 18 a 24 años. Fue una encuesta bastante larga, que en promedio tardaban 30 minutos. Al inicio nos decían que, bueno, era muy larga para adolescentes, pero realmente fue interesante los comentarios positivos que recibíamos sobre esta encuesta, de que les permitía como pensar y reflexionar sobre el impacto que estaba teniendo el COVID en sus vidas. Es una encuesta que abordaba estas distintas dimensiones para entender justamente qué es lo que estaba sucediendo a nivel de los hogares en términos de pérdidas de empleo, de cambio en las dinámicas de los hogares, de la situación económica, de las normas de género, también la situación que estaban viviendo en torno a la salud, a la violencia, pero también pues, las medidas que estaban tomando para poder mitigar el impacto de la pandemia. Desde el inicio del estudio fuimos de la mano con gobierno, particularmente con el INJUVE, con el Centro Nacional de Equidad de Género, con sociedad civil y con un grupo de jóvenes que nos ayudaron a diseñar el estudio, y a través de distintas vías de diseminación que fueron a través de las propias redes de gobierno, promotores de salud, también las redes juveniles del INJUVE, y a través de la sociedad civil, pues logramos llegar a más de 123,000 participantes, de los cuales 55,000 completó la encuesta y más de 32,000 aceptaron continuar con nosotros en el estudio. La siguiente, por favor. Siguiente. Next slide. Y bueno, hoy les presentaré los resultados de esta primera ronda de levantamiento, que es la línea base de la Corte. Les comento que todos los resultados están disponibles ya en la página de internet del estudio, www.vocescontralaviolencia.org. Ahí encontrarán toda la información de la encuesta. Ustedes pueden desagregar la información, si ven del lado izquierdo en la columna, verán que se puede desagregar la información por género, por nivel socioeconómico, por edad, bueno, pues es parte de lo que ofrecemos, digamos, del estudio, para que haya información accesible y transparente, ¿no? sobre el estudio. La siguiente, por favor. Y bueno, les presentaré la siguiente, next slide, please. Les presentaré algunos datos sobre cada una de las dimensiones. Si bien van a ser datos muy puntuales, la encuesta es todavía mucho más amplia. Pero bueno, pues en cuanto a la dimensión educativa, sabemos que la disrupción escolar por las medidas de distanciamiento social pues fue generalizada a nivel nacional. El 23 de marzo se cerraron las puertas a la educación presencial, y la única manera que podía darse la continuidad educativa era a través de medios digitales. También el gobierno implementó algo a través de televisión y radio, pero justamente tratando de entender el acceso a estas tecnologías, pues preguntamos en la encuesta si tenían acceso privado al internet en sus hogares. Del lado izquierdo presentamos la información y les presentamos las diferencias por nivel socioeconómico para que vean el grado de la brecha existente por nivel socioeconómico. 99% de los hogares del nivel más alto mencionaron tener internet en sus hogares, mientras que el 40% del nivel más bajo lo hicieron. En cuanto al acceso a los recursos para continuar con sus tareas y trabajos escolares, pues el 79% del nivel socioeconómico más alto mencionó que sí pudo tener acceso a estos recursos, mientras que solo el 30% del nivel más bajo. Además, la pandemia también ha cambiado las expectativas de jóvenes y adolescentes en cuanto a los logros académicos que tenían planeados. 1 de cada 4 mencionó que probablemente lograrían completar menos años de estudio de lo que habían planeado previo a la pandemia. Siguiente, por favor. Next slide, please. En cuanto a la situación de violencia, pues encontramos un impacto diferenciado a nivel de la percepción y experiencias de violencia, tanto en los hogares como a nivel comunitario. Nos preguntábamos si había un cambio en el nivel de violencia en los hogares y 28%, una tercera parte de participantes nos mencionaron que había incrementado la severidad y la frecuencia de los actos violentos en sus hogares a raíz de la pandemia. Y bueno, también encontramos que el género era un predictor significativo en el incremento de las percepciones de inseguridad a nivel comunitario y también de la percepción en cuanto al crimen en sus comunidades. 27% de las mujeres y 36% de la población no binaria mencionaba pues, que se había incrementado la inseguridad en comparación con 21% de los hombres. En cuanto a las normas de género, pues también nos interesaba conocer qué es lo que estaba sucediendo a nivel de los hogares, cómo influían estas normas y esta división de responsabilidades a nivel del hogar en cuanto a las percepciones de violencia, el incremento de experiencia de violencia, y encontramos que los participantes que vivían en hogares más equitativos en esta distribución de tareas y normas de género, pues tenían menos probabilidad de sufrir el incremento de violencia a nivel de sus hogares a partir de la pandemia. Y esto pues es un dato interesante, ¿no? Siguiente, por favor. En cuanto a las inequidades de acceso a los servicios de salud y a los servicios de salud sexual y reproductiva, pues en México se realizó una reconversión hospitalaria muy amplia para atender a los casos de COVID, dejando un poco fuera la atención general a la salud. Y bueno, pues encontramos importantes barreras de atención. El 53% de adolescentes y el 75% de adultos jóvenes mencionaron que percibían un incremento de barreras de acceso a los servicios de salud general. Y en cuanto a los servicios de salud sexual y reproductiva, 20% de los adolescentes y 38% de adultos jóvenes percibieron un incremento en las barreras de acceso a los servicios de salud sexual y reproductiva. Es importante comentarles que aquí sí hubo brechas de género. Las mujeres principalmente fueron las que enfrentaron mayores barreras en comparación con los hombres, y también las y los participantes que vivían en hogares de menores recursos. Siguiente, por favor. Y next slide, please. Y en cuanto a la vulnerabilidad económica, también las mujeres y las y los participantes que vivían en hogares de nivel socioeconómico más bajo estaban sufriendo más importantemente el impacto económico de las medidas de mitigación del COVID. El 58% de los hogares del nivel socioeconómico más bajo mencionaron que al menos una persona de su hogar había perdido su principal fuente de empleo y también había cerrado su negocio a raíz del COVID, en comparación con 22% de los que vivían en el nivel socioeconómico más bajo. Y esto también se reflejaba en que el 16% de los hogares más pobres no habían podido cubrir la renta de sus hogares, en comparación con 3% del hogar del nivel socioeconómico más alto. Además, pues también las mujeres estaban enfrentando mayores retos para poder contener la situación económica. Ellas reportaron en menor proporción recibir apoyo gubernamental a raíz de la pandemia en comparación con los hombres. Siguiente, por favor. Next slide, please. Next slide. En cuanto a la salud mental, pues sabemos que es un problema que venía creciendo en el país, pero definitivamente la pandemia recrudeció las expresiones de depresión, de ansiedad en las y los adolescentes y jóvenes. 7 de cada 10 habían experimentado síntomas depresivos en las 2 semanas previas a la encuesta. 23% de ellos, los síntomas eran lo suficientemente graves como para requerir una atención médica. Y una tercera parte mencionó pues tener ideas de muerte, ideas de dañarse a sí mismos, o sea, ideas suicidas en las 2 semanas previas a la encuesta. Otro tema que nos interesó también indagar fue sobre el consumo de sustancias. También adolescentes y jóvenes incrementaron su consumo de sustancias. Un 14% mencionó que había incrementado su consumo de alcohol y un 21% el incremento en el consumo de marihuana o cannabis. Y cuando preguntábamos sobre las medidas de afrontamiento que estaban teniendo adolescentes y jóvenes a raíz de la pandemia, bueno, pues el 55% utilizaba más redes sociales y el 51% mencionó que estaba menos en contacto con amigos y familiares a raíz de la pandemia. Siguiente, por favor. Next slide, please. Next slide. Y bueno, un poco con los resultados que estábamos teniendo de la encuesta y también a través de las comunicaciones que teníamos directamente a través de la plataforma con las y los participantes, bueno, veíamos que el tema del acceso a los servicios de salud y también la atención a la salud mental era muy importante. Hicimos pues estas colaboraciones con gobierno, con el Centro Nacional de Equidad de Género y con el Instituto Mexicano de la Juventud para que mapear los servicios de apoyo a adolescentes en temas de salud sexual y reproductiva. Se mapearon los servicios a nivel nacional y también a través del programa Contacto Joven del INJUVE se les estaba dando atención a la salud mental directamente. Además, abrimos una plataforma para presentar algunas historias sobre juventudes que pudieran compartir con las y los participantes, tratando de generar una comunidad a través de voces. Y bueno, pues con toda esta información lo que nos interesa es expandir, digamos, las alianzas a nivel gubernamental y a nivel de las organizaciones de la sociedad civil que acerquen recursos y servicios a las juventudes en cuanto a salud, en cuanto a empleo, en cuanto a atención a la violencia de género y atención a los grupos indígenas y afrodescendientes y población identificada como no binaria. Estamos ampliando los recursos también a través de la plataforma. Además, estamos intentando generar esta comunidad de acción, visibilizando los talentos y las iniciativas que está trayendo la población, las juventudes a la plataforma. Y estamos también diversificando las estrategias para alcanzar a la población más vulnerable. Sabemos que de la primera encuesta pudimos alcanzar solo los que tenían cobertura a través de medios digitales. Ahora estamos haciendo un levantamiento en población callejera en la Ciudad de México, justamente para alcanzar a la población más vulnerable. Queremos también, junto con el INJUVE, pues intentar ampliar la cobertura del estudio a nivel regional. Y bueno, pues hemos hecho algunos ajustes también a la encuesta que va a iniciar el próximo noviembre, va a estar abierta de noviembre a febrero del siguiente año, en donde vamos a seguir tanto a la corte, a los que aceptaron participar en las siguientes rondas, como a nuevos participantes. Siguiente, por favor. Next slide, please. Y bueno, con esta experiencia lo que hemos visto es que más allá de la generación de evidencia, Voces busca ser una plataforma orientada a proveer información y una acción colaborativa tanto de los distintos sectores del nivel gubernamental, de sociedad civil y de las juventudes en atención a sus necesidades. Sabemos que el impacto ha sido pues, generalizado de la pandemia, como comentaba Karen, pero realmente hemos visto que hay grupos particularmente vulnerables, la población que se autodefine como no binaria, la población indígena y afrodescendiente y también de los niveles socioeconómicos más bajos. Sabemos que se requieren abordajes multisectoriales, integrales, para que consideren a los adolescentes y a los jóvenes al centro de las acciones para lograr atender y mitigar el impacto de la pandemia, que sabemos que va a ser todavía un impacto que se espera de largo plazo, y habrá que definir los mecanismos para incorporar a los jóvenes en estas medidas. Siguiente, por favor. Y bueno, pues es importante la generación de evidencia para monitorear y evaluar el impacto de las diferentes estrategias y los programas que están implementándose a nivel de gubernamental. Esto lo hemos incorporado directamente en el estudio Voces para tratar de medir de qué manera están contribuyendo estas acciones a mejorar las vidas de las juventudes. Y bueno, pues vamos a continuar de la mano, esperemos que muchas rondas más, para poder crear sinergia entre los distintos sectores y lograr acompañar en esta decisión basada en evidencias de la política pública de jóvenes y adolescentes. Muchísimas gracias. Over to you, Karen.
Thank you so much, Isabel. Again, another fascinating presentation, and just, I mean, it's interesting to reflect on some of the similarities between Kenya and Mexico, and really exciting to see how in such a short time the data being collected has led to real practical action, and in both countries is leading to more research. So hopefully this research, to evidence to practice cycle will continue. So at this stage, we're going to have about 10 minutes for questions and answers for Isabel and Beth, who is being not replaced, but joined. I think Beth had to go, but by Dr. Tim Abuya, who's another co-investigator on the Kenya study. So I'd like to, Isabel, you have your video on. Tim, invite you also to put your video on. And then for all of our participants today, please feel free to add your questions to the Q&A. They could be directed towards Isabel, Tim, both of them, and we will engage over the next 10 minutes. So a question for Isabel, a bit of a specific one, related specifically to substance abuse, and how you noted that you saw increased rates of substance abuse during the pandemic. Did you see if there was perhaps a noticeable difference in those increases by gender, or perhaps any other sort of demographic?
Bueno, en cuanto al consumo de sustancias, hubo un mayor consumo de sustancias en los adolescentes del nivel socioeconómico más alto, sobre todo en el consumo de alcohol, pero no vimos diferencias importantes en cuanto a género y intensidad.
Thank you, Isabel. So this is a question for both of you. If you could reflect a little bit about what was it actually like to field a survey in the middle of the pandemic? And I know Tim, the Pop Council Kenya team, very quickly within the first few weeks of the first cases in Kenya was collecting data. So if you could reflect a little bit about that experience, what were some of the challenges, some of the surprises, and maybe in that also, I see another question, if you can think about, so all of you had quite a span of types of adolescents in your sample, whether it be age or gender. So were there any special considerations given, in particular when reaching the extra vulnerable groups, or those maybe youngest girls, 10 to 14? What were some of the considerations that the data collection team took to make sure that they were safe, protected, etc.? So maybe we'll start with you, Tim, and then for some reflections, and then over to you, Isabel.
Thanks, Karen, and thanks everyone for joining this webinar. I think a couple of things in terms of experience in the Kenyan setting was to quickly think about, what opportunities do we have to engage and collect data that would be useful for action and decision making. And having a cohort that was there in place provided that opportunity. Thinking very quickly around what models of data collection we could pick up on, we obviously decided to use virtual platforms to be able to reach these groups of young people. Now, a number of challenges there is about, having to access them through their parents, consenting processes around being able to tell them this is what we need to talk about, and some sensitive questions that came out, around, relationships and sexual issues, and all those things have to be considered very well in terms of how you design the questions and how you ask those questions to the young people on phone. I think those are some of the generic challenges that we went through in the Kenyan setting. There's a very specific question that Jodis Booth is asking on special measures around to reach the youngest girls. I think that's very important, especially the young girls between 10 to 14 years who are probably in the hands of their parents and guardians. It's relatively important to think about, how do you actually reach them in a safe space that is quite convenient for them, and also they're able to respond to the issues that you're asking. I think that's quite a challenging issue when you think about asking these questions virtually, because obviously you won't be very sure about the safe space these children are, these adolescent girls are. So quickly, I want to reflect that it was quite an amazing moment to think about, to take advantage of the existing cohort and quickly collect data that was useful for action. But at the same time, it was important for us to consider the nature of vulnerabilities that these girls go through and carefully design our questionnaire and tools around that. Over to you, Karen.
Thanks, Tim. Go ahead, Isabel.
Thanks, Karen. Bueno, creo que para nosotros, fue muy interesante. Veníamos de diseñar un proyecto que estaba enfocado a trabajar en las escuelas, y de pronto tuvimos que cambiar completamente el enfoque del proyecto para iniciar la recolección de datos de voces. Fue todo muy rápido. La verdad es que había varias encuestas en línea y pensamos que iba a ser poco probable que nos respondieran, porque había varias encuestas que estaban saliendo al mismo tiempo. Y además, pues, llegar a jóvenes de entre 15 y 17 años nos decían que era un reto, ¿no? Un reto también llenar una encuesta tan larga, era en promedio de 30 minutos. Y realmente fue sorprendente, ¿no? Que en un inicio íbamos recibiendo las respuestas muy poco a poco, nunca pensamos llegar a los niveles que llegamos. Pero poco a poco, con la incorporación, con la colaboración de gobierno, de sociedad civil, de conectar con las personas correctas, pues fue que pudimos llegar a las adolescentes y juventudes de manera más efectiva. Algo que fue interesante fue que en la encuesta nosotros al final teníamos un espacio para que pusieran comentarios y para un poco saber si les hacía sentido la encuesta, cuáles eran sus preocupaciones. Con ello también, pues, implementar ciertas acciones y mensajes específicos y tejidos, ¿no? Creo que esa comunicación directa con los participantes ayudó mucho a mejorar la tasa de respuesta de la encuesta. Y en esos comentarios lo que nos decían es gracias, ¿no? Gracias por esta encuesta que nos permite reflexionar sobre lo que nos está pasando, ¿no? Por la pandemia. Y eso, bueno, fue muy interesante. Nosotros, a diferencia de Kenia, no teníamos una corte preestablecida. La incorporación de jóvenes al proyecto también, que nos ayudaran a pensar en mensajes, en imágenes que podrían ser atractivas para las juventudes, también fue importante para lograr este impacto. Y sobre todo, pues, la colaboración estrecha con el gobierno, con el INCUBE, que la colaboración fue increíble desde el inicio. Realmente vieron los aportes de este proyecto y entonces se sumaron directamente desde el inicio, buscando distintos canales, redes de colaboración. Los promotores de salud, que eran juventudes también, que fueron casa por casa también promocionando el estudio. Entonces creo que fue un trabajo muy interesante ver cómo fue creciendo el interés y que veían realmente el valor del estudio, ¿no?
Thank you so much. So another question for both of you to reflect on, were there any geographic variations within your data sets, maybe one or two highlights that you found particularly interesting? I know in Kenya, the quantitative data was from 4 different counties in the country. I believe, Isabel, from the map, it seemed like it really was a national survey. So any differences in adolescents' experience based on where in the country they were living? Maybe I want to start with you, Isabel, but I also want to give you a little break to catch your breath. Why don't we start with Isabel this time, and then we'll go to Tim. Sorry.
Claro que sí. Muchas gracias, Karen. Pues sí, en términos geográficos sí tuvimos retos en algunos estados. No podría decir que tenían ciertas características particulares. De las 32 entidades del país, realmente tuvimos información suficiente, digamos, o la que esperábamos o la que habíamos planteado como meta en 20 de los 32 estados. A nivel de la Ciudad de México, que es el estado, digamos, más poblado del país, quisimos ampliar la muestra para tener información a nivel de las alcaldías, y las alcaldías que tenían más retos, que eran más rurales, que había una población mayor de indigenismo, fueron los que tenían más retos para completar la encuesta. Y ahí fue muy importante la colaboración con estas alcaldías, con la Secretaría de Educación Pública, para llegar a esta población que tenía mayores retos y mayor brecha digital, ¿no? Lo que es interesante es que en proporción tenemos una participación alta de población que se define como indígena o afrodescendiente, y esto la verdad es que no lo esperábamos, pero tenemos una proporción similar a la que se encuentra en el censo. Entonces esto también pues, fue interesante, ¿no? Porque sí llegó la encuesta también a los más vulnerables, como vimos los resultados que presentamos por nivel socioeconómica, pues sí logramos tener una variabilidad de representación de grupos de acuerdo a la vulnerabilidad.
Thanks, Isabel. Tim, any thoughts on geographic variation?
Yeah, that's a good question from one of the listeners on the webinar. I think there are, initially I'll talk about variations by region as well as with time. I think in the initial stages of the study, we obviously did the urban setting, where we see varying levels of knowledge and understanding of certain aspects of preventive measures for COVID-19, as well as experiences of young adults, young adolescents in this context. As we move to the rural settings, we saw slight variations in terms of exposure and challenges of whether it's education, access to education because of the remoteness, and access to digital platforms and so forth. So these variations were generally linked to the geographic settings, as well as the exposure that we thought across sites on the issues related with COVID-19 pandemic exposure effects, as well as the preventive measures, adherence to preventive measures. And I think those are differences we saw by setting, but also over time we saw changes in terms of different rounds of data collection, which obviously were a response to the changes in the context and the experience of the pandemic over time. Over to you, Karen.
Thank you. Real thanks again to our presenters, Isabel, Beth, and Tim. I know there are still additional questions, so maybe I want to make sure that those questions get put. I think some of them are, but maybe not all of them are, into the Q&A, and then maybe Isabel and Tim, as we move on to the next part of the webinar, you can just have a look and write up some responses to the remaining questions from our audience. So thanks again to you, really both for the important research work and sharing that today with us. So now I want to turn to our panelists. So I'd like to invite Guillermo, Santiago, and Julie Moabe to turn on their videos. Again, we know you are both incredibly busy, and we thank you for making the time to join us today, especially Guillermo. I think it's quite early for you, so much appreciation. And I really think that So now we've had a chance, we've heard the data that came out of these two studies, a little bit about what we found, the experience of adolescents in Mexico and in Kenya, how they've been experiencing this pandemic over the past year and a half. But, I think we want to hear your side of the story as well, and a bit more about how these studies came to be, your role in them in the beginning as they were going on and after data collection has been completed. So I want to start by thinking, if we reflect back to the early days of the pandemic, sort of February, March, April 2020, everyone was operating in emergency mode, right? Responding to crises. That really the pandemic, as we heard, affected not only all ages in a society, but all sectors. So health, clearly there was a virus, but also how the pandemic then had ripple-on effects in the health sector, education with the school closures, the economy. But during that time, I was wondering if you could share with us and reflect a little bit. So what motivated you to pause and think about research, right? Everyone was moving so fast. We have to act, we have to act. And you made the decision for part of your response to include research, which means moving a little bit more slowly, not necessarily being able to have the answer tomorrow. And so if you could talk to us a little bit about that motivation, what the process was like, and in sort of commissioning these studies, what led to your partnerships with Population Council for these studies, and just a bit about sort of if you could take us back to the inception and how that, tell that story from your perspective. So I think let's start with Julie, and then we'll go over to Guillermo. So over to you, Julie.
Thank you. Thanks, Karen. And thank you for the presentations earlier. It's really interesting to see what's happening in Mexico as well. And even as I was listening, I was like, oh, I mean, this is something we can, especially the program, so connecting adolescents, that's something for sure that we'd love to borrow and glean off you on how to do that. When it comes to the study, I think as the Office of the President, at the beginning of last year, just even before the COVID pandemic, the President had sort of requested zero in a spotlight on young people, on adolescents. So even before COVID, we had started out the mapping, trying to figure out what the adolescent programming were in Kenya, where the gaps are. And that's actually how I ended up meeting the Population Council, because you already had the cohort and I was really interested in asking questions about where were the gaps. And so when COVID came, as much as we really wanted to understand the impact COVID had on this cohort, the young people, it just sort of gave us an opportunity to shine a spotlight. I think when you look at issues like teenage pregnancies, I mean, there was already a crisis in Kenya, and COVID just allowed us, an opportunity to focus, zero in on the research and be able to spotlight this with policymakers, all the leaders, all the way to the very top, and actually sort of bring an eye and attention to the adolescent framework and how the programming has worked. When we began, we reached out to the different ministries to sort of gauge interest on what the adolescent programming was and what they were doing. It became very clear that everyone was working in a very siloed manner, where the Ministry of maybe Health would be dealing with the sexual reproductive health, and then Ministry of Education would be looking at the 100% transition from primary school to secondary school. And then we have a Ministry of Social Protection who would be looking, they're already doing like the violence against children studies. So, I mean, this was just an opportunity for us to say, look, is there a way that we can find a means to work together and using data? I think it's one thing to have anecdotal evidence, but this was a chance for us to say, look, we have the numbers and the numbers won't lie. And that's why we decided to take our time. It took us a year to run through the study, but it has been probably the most rewarding study because it's just data that we didn't have. And I've had very many people from government saying it's good that now they're not using 2001 data, but they have 2021 recent data that is also sort of insightful in their programming and their projections as well.
Thank you, Julie. Guillermo, let's hear your side of the story.
Claro, buenos días a todos y a todas. Muchas gracias por esta oportunidad y por la invitación de Population Council para estar aquí con ustedes. Efectivamente, estoy ahora en el norte del país con 2 horas menos que el resto de México y entonces eso nos hace estar un poco desmañanados, pero estamos en una gira de trabajo pues muy entusiasmado y muy contento de poder estar aquí con ustedes. Saludarle a Karen, a Isabel, a Beth y a Julie. Es un placer compartir con ustedes. Y bueno, justo al inicio de la pandemia en México, como en todo el mundo, nos tomó, si bien no tanto como por sorpresa, pero los servicios y la atención del gobierno en general se centró en la atención inmediata de la atención de toda la población en general, pero algo que también no solamente vimos que fue una crisis de salud, sino que la salud era la punta del iceberg, pero nos dejó ver con mucha más fuerza y mucha mayor intensidad por las desigualdades por las que atravesaban todas las personas, pero especialmente las juventudes. Y esto lo logramos observar porque en el tema del empleo, las primeras personas que fueron despedidas fueron las y los jóvenes, porque al tener menor antigüedad era mucho más sencillo, y lo pongo entre comillas, despedir a las personas jóvenes. Otro de los grandes problemas que observamos y que nos dimos cuenta de que era necesario hacer algo al respecto en el tema educativo. Al convertirse todo virtual, también nos dejó ver la brecha digital que existe aún en nuestro país y que ahora estamos trabajando de manera muy fuerte para poder aminorar los impactos y poder trabajar de manera conjunta para ir reduciendo estas brechas de desigualdad. Entonces, algo que observamos y también algo que vivimos muy rápido es ver cómo se empezó a deteriorar con mayor fuerza la salud mental de las y los jóvenes. La pandemia no solamente tenía que ver con la salud, sino, yo le digo, con las pérdidas. La palabra pérdida fue una palabra muy importante porque perdíamos salud, perdíamos a seres queridos, perdíamos trabajos, perdíamos escuela. Entonces entramos en un proceso de pérdidas en el que era necesario, por parte del Estado, responder que aquí en México el presidente de la República, el licenciado Andrés Manuel López Obrador, dio la indicación de mantener a flote todos los programas sociales y hacer recortes presupuestales, pero en gasto corriente, en sueldos del gobierno federal. Yo coincido con él que el gobierno tiene que apretarse el cinturón en el pueblo en momentos de crisis como esta. Entonces, al observar que teníamos un problema no solamente de salud, sino social, cuando Population Council nos hace la invitación para participar en Voces 19, por supuesto que decidimos sumarnos de manera inmediata, porque al ser el Instituto Mexicano de la Juventud el órgano rector de la Política Nacional de Juventudes, necesitábamos y necesitábamos la mayor cantidad de datos posibles para saber cómo responder. Ya lo que no podemos perder de vista es que la respuesta, si bien fue inmediata, en ese momento de la pandemia, la respuesta tiene que seguir, tiene que continuar, porque los efectos de la pandemia pues aún se siguen viendo y los estaremos viendo en los próximos 5 años fácilmente. Entonces, justo por eso es que decidimos sumarnos. En el Injuve estamos convencidos de que lo mejor es trabajar de manera coordinada y en alianzas. Y justo esto nos entusiasmó para trabajar como Population Council en Voces 19 con la intención de sumarnos de manera sustancial en la difusión de la encuesta con adolescentes y jóvenes, pero sobre todo como una gran oportunidad para coordinar acciones con diversos sectores.
Thank you to both of you for sort of sharing what was going on at the start of the pandemic when these studies started. I wanted to know if you would reflect a little bit about, so my understanding is that in both Voces 19 and in the PASU study, not only was data collected from adolescents, but and youth, but these studies really engaged them more deeply. So I wanted to know if you could describe a little bit about that process, why you think, why do you see that as an important part of the work, how maybe it's enriched what you've been able to do with the data. And so some reflections there. So maybe this time, Guillermo, we can start with you and then we'll go over to Julie.
Claro que sí, con muchísimo gusto. Compartirles que Voces 19 en México tuvo una gran participación de personas adolescentes y jóvenes. Más de 120,000 personas respondieron al llamado y esto es una cosa extraordinaria para nosotros. Es una muestra, bueno, si bien las dimensiones de México son muy grandes, pero es una muestra representativa que nos permite darnos luces de las situaciones por las que se atravesaron. Algo que nos encanta es que 120,000 personas invirtieron su tiempo, su experiencia, sus sentires, y nos habla, por un lado, nos demuestra que es falso que las juventudes son apáticas, que es un mito que creo que en todo el mundo está, y especialmente en México, de que las juventudes son apáticas o renuentes a participar. Eso es completamente falso, sino más bien que se requieren de herramientas y mecanismos, espacios que permitan que las y los jóvenes participen y sobre todo que sean escuchados y lo más importante, que puedan incidir en la toma de decisiones. Esto es vital y fundamental. La voz de las juventudes representa el sentir de sus necesidades, de sus demandas, de sus dolores. Y no solamente tenemos que hacer un ejercicio de escucha, sino un ejercicio de empoderamiento y de acompañamiento y fortalecimiento a la toma de decisiones desde las juventudes. Porque no se trata de recabar peticiones, sino de acompañar causas, que para mí eso es vital y es trascendental. Y también tener sus percepciones nos permite tener un panorama de no solo cómo se está viviendo la pandemia, sino de cómo podamos hacerle frente a sus consecuencias, a mejorar las acciones del gobierno para poder salir adelante de esta situación. Es cuanto.
Thank you. Really important insights. Julie, do you want to reflect on the experience in Kenya?
Thanks, Karen. And yes, just to add to what Guillermo says, it's it's beyond just listening to their voices. It is how do you actually and genuinely and authentically include them in the process. When we looked at what we're doing in Kenya with the study, even with the presentation Beth shared earlier, those images were actually girls who are part of the study. We really listened to them. We sort of, even with the rounds of data, went back for them to validate the information and say, look, does this sound like you? Is this what you'd like to put forward? All the way through when you're launching the report. So I say this all the time, that adolescents, young people should not be props. They shouldn't just come to your event, do a poem, sing, and for you to look at and say, we have them here. But how do you sort of genuinely engage them through the process and in leadership, and that you're actually hearing them? They are the change agents. These change agents, they know what they want. Across the study in different parts of Kenya, they were giving answers to what is working for them, what works, but then it's amazing how when we come to policy making, when it comes to decision making, they're not there. We don't include them. We don't make it easy for them. We may say they're in school, so let's leave them out, but we don't find moments to engage them in a way that's just so edifying. When you look at the recommendations that Beth highlighted earlier, these were recommendations from adolescents themselves. And I think it's up to us to sort of do justice to them, to ensure that we are ensuring that their voices are being heard in those decision-making and platforms, and that we are actually and genuinely creating spaces for them. So, and we are, with this study, we are continuing to do that. Actually, one of the things that even with this sort of setting we have today, maybe the challenge would have been, how do we ensure that adolescents are actually part of the conversations that we continue to have, and that we too are holding ourselves accountable to that kind of discussion and ensuring that we include them at all levels.
Thanks, Julie. Can I push you a little bit further? So I think a lot of people on this webinar probably agree that we should be listening to adolescents, but you actually did it. Can you just talk a little bit more about the details of people would say, oh, it's COVID, or oh, they don't have telephones. You know, what did your study do to, you know, you said you validated the results with adolescents. What does that actually look like? So, you know, teach the rest of us on the webinar.
I'm not sure about teaching, but you know, I think one of the things that we were very clear from the beginning, and you know, what discussions we had with Population Council right at the beginning was, how do we go to them? So when you look at phones, for example, you know, phones are owned by parents, but then still having those discussions and ensuring that we find a way of talking to the adolescents. And to be honest, and I saw this a lot, especially when we were going out to the field, when a parent is there, sometimes they give you different answers, you know, that give you the answers that they think you want to hear. And then when you have a moment with them and they feel comfortable and safe, the answers sometimes would change and they can give you the real picture. And so I think one of the strengths of this study was the quantitative and adding the qualitative bit of it. When it came to validating, we were able to sort of have the cohorts in the different locations sort of come together to maybe to a chief or a community-based organizations, and they were able to zoom in and then all hear from each other. And of course, the conversations start always very formal. They sort of feel like they have answers they want you to have, but as they relax, as they feel safe, as they feel that they're being heard, you know, the real answers would come out. And I really feel they felt very validated. I've stayed in touch with so many of them. Unfortunately, I mean, I've had stories of girls who met during the study who, you know, were in because of COVID, the school class, and towards the end of the year, they were unmarried off. You know, they were married off, and you sort of see generations essentially disrupted, you know, real girls who now have had to go through FGM, some who've gotten pregnant, like, you know, the girl whose picture was on one of those presentations. So these are just real stories, it's not just statistics that we are putting out, it is actually real lives and seeing how they've really being disrupted. And I think it's how do we urgently to sort of move and essentially try to sort of gain some of those progress that has been reversed in some ways.
Thanks, Julie. So one final question from me before we open it up to the audience. So I wanted to know if you could just reflect a bit more broadly about the relationship between government and researchers. And, you know, you've both talked about the importance of data and having the data to make decisions, but maybe could you tell us a little bit more about, you know, and we say like, yes, you know, evidence-based decision making, but can you reflect a little bit about maybe some of the challenges? And from your seat in government, what can researchers or those who generate data communicate data and evidence? What can we be doing better to really strengthen that relationship between government and researchers, or government and, you know, facilitate that evidence to practice continuum from your perspective? I think, you know, in the context of COVID-19, we've heard two examples of how that's being done, so you can reflect on it in the context of the pandemic or more broadly, hopefully when we find ourselves one day recovering or post-pandemic. So maybe we'll start with you, Guillermo.
Claro que sí, con mucho gusto. Considero justo este planteamiento nos lo hicimos al inicio de la pandemia, porque estábamos en un terreno en el que nadie tenía datos, nadie tenía exactitud de qué estaba sucediendo, cómo estaba impactando, cómo teníamos que reaccionar. Y creo que es muy importante, y algo que observamos es que es sumamente valioso y sumamente necesaria la relación entre la investigación, las y los investigadores y quienes ejercemos la política pública, porque esto nos permite llegar de manera más precisa. Por ejemplo, en México, cuando inició la pandemia, tuvimos varias reuniones con la Secretaría de Salud y en especial con el Consejo de Salud Mental. Ellos hicieron un primeros test, un pequeño mapeo, y se detectó, por un lado, que las personas con depresión y personas con problemas emocionales se incrementaron o se intensificaron sus problemas. Entonces, como respuesta inmediata, lanzamos un programa desde el Instituto Mexicano de la Juventud que se llama Contacto Joven, que es un programa de atención psicoemocional para jóvenes de todo el país, en alianza con UNICEF, con la Secretaría de Salud y la Facultad de Psicología de la UNAM. Y aquí pudimos experimentar de viva voz cómo la investigación fue necesaria para poder responder a una situación que estábamos enfrentando en el país como uno de los efectos colaterales de la pandemia del COVID-19. Independientemente de la respuesta en temas de salud que se tuvo que dar, aquí tuvimos que reaccionar en automático a un problema que estaban viviendo las personas jóvenes generadas por el aislamiento. Y también observamos, por ejemplo, otro gran problema que enfrentamos porque las violencias que viven especialmente las mujeres jóvenes se intensificaron, dado que lamentablemente gran parte de los agresores viven bajo el mismo techo. Entonces, también estos estudios que se realizaron de manera muy expedita nos ayudaron a responder y a salir avantes y a poder dar una respuesta inmediata. Creo que si con esto concluyo mi participación, la investigación quedó más clara que es necesaria e indispensable para poder dar respuestas asertivas a los retos que enfrentamos hoy en el mundo y en nuestros países. No solamente por la pandemia, sino por cómo estamos conformados como sociedad, y también algo necesario y que ha permitido también la investigación, y que yo haría un llamado también, es a sentar y reconocer las diversidades de las juventudes, que la homogeneidad no aplica siempre, porque el territorio, porque las condiciones culturales, económicas y sociales muchas veces son determinantes en el ejercicio del proyecto de vida que nosotros busquemos y queremos. Entonces, al reconocer estas diversidades nos permite entender que la política pública tiene que ser diversa y que tiene que llegar y atenuarse de la mejor manera posible, entendiendo de que pues no es posible tratar de o querer atender exactamente igual a todos cuando hay condiciones distintas. Y justo esto hablamos de poder garantizar el ejercicio pleno de los derechos de todas las personas, comprendiendo sus contextos sociales, culturales y económicos, para a partir de ahí poder atenderles y poder acompañarles. Muchísimas gracias.
Thank you. Julie, any thoughts?
Yes. I mean, just I guess to answer your question on, what can researchers, to do with the evidence and how do we present it to government? I think one of the key things I'd say it is sometimes how we package the data. I mean, as researchers, we at times, we as a researcher might be speaking the language that you understand. So it is, it could be in your articles or what we're putting out of the data, and it's always so good and strong. But then how do we reach the policymakers? How do we break down this information into pieces that they're able to divulge? And I say this because now when you look at the world is, the social media and everything is so fast. How do you essentially catch up policymakers in 3 minutes? What are those sort of packages or things that we could think of that may be outside your box, but then is a way that would reach public, someone in government or in policy, and that will sort of touch on their emotions, touch on their hearts, touch on their urgency to do things. And so that is one of the things that I think we'd think through strongly. And I think when we were working with Population Council on this data, I mean, the data was so rich and it's so strong, but then, you know, we sort of pushed the envelope and said, can we do it in a documentary format? Can we do it in, you know, sort of position papers, like short things that, you know, short videos that would, and I think for most people who've actually had or looked at this study has been in those sort of quick and dirty sort of pieces that have really worked. So I think it's us as researchers trying to think, okay, how do I sort of get out of the box and present this information in a way that can be acted on, can be accessed easily, and can be consumed at the same time remain very impactful.
Thank you so much. So we've had a couple of, those are some just really important, interesting insights that I'm enjoying reflecting on. But I want to we have a couple questions from our audience before we wrap up today that I want to ask to both of you. So one question is, they're sort of asking if both of you could provide a specific example about how the evidence or the data from these two studies shaped a specific decision that happened so far in the course of the pandemic. Julie, you want to start?
Sure. I think one that I would highlight is, so when we began the study in Kenya, when we went to the Ministry of Gender and we're asking adolescent questions on young people, the Ministry of Gender highlighted that a lot of their work handled the women, and because adolescents mostly under 18, so they sort of belong in a different ministry, which is ministry in Kenya, I think it's social protection. But then with this data, I think one of the key things we've been able to do is sort of bring in the Ministry of Gender strongly. They came in and launched the report, and they have been open for us discussing on how to have an adolescent specific directorate in the Ministry of Gender, meaning that a space where, whether it's working on education, sanitary pads distribution, health, SRH issues, education, that they're all sort of sitting in one space so that it sort of supports that whole multi-sectoral approach that we've been trying to push for. And so that is something that is still in the process. We're working up the roadmap and working very closely with the Ministry of Gender on that. So I think that is a very big win coming from the study, that it has pushed government and those in policy to be like, okay, maybe we can look at a different way of programming this, and also looking at it on county levels and which counties have been able to come together and sort of have that multi-sectoral approach that is working, and be able to see if we can scale that up across the various counties in Kenya.
Thanks, Julie. So really the study and the evidence showing that sort of all of these different areas of adolescents' lives are impacted, shaping sort of the type of response, that it can't be only on education, only on health, but we really need to, what spaces do you need to create in order to see that? That's great, thank you. Guillermo, do you have an example of sort of so far how you've been able to concretely use the VOCIS data?
Claro, con gusto. Como lo mencionaba anteriormente, Contacto Joven el VOCIS-19 nos ayudó a mejorarlo, a afinarlo respecto a atención. Pudimos comprender un poco mejor, bueno, mucho mejor más bien, las necesidades que tenían las adolescentes, especialmente las adolescentes jóvenes en México, para poder tener respuesta ante la necesidad que tenían. Y por otro lado, también el tema de salud sexual y reproductiva nos ayudó también a ver el uso de preservativos, disminuyó considerablemente durante la pandemia, ¿no? Porque, bueno, los servicios de salud se enfocaron en el tema del COVID y eso se limitó el acceso, y también esto impactó en el ejercicio de la sexualidad de las y los jóvenes durante la pandemia. Entonces, eso también nos ayudó a alertar y a poder trabajar de manera más intensa en las estrategias nacionales que tenemos en México, como la Estrategia Nacional de Prevención del Embarazo en Adolescentes, para poder responder y atender de manera más eficiente esta situación.
Thank you. That's great. Okay, one final question that I see came in from the audience. I think we have about time for one more. So, I think we heard from both Beth and Isabel's presentations, and I think both of you have touched on it in your comments as well. Sort of different population segments, right? Like, I think Guillermo, you said, there is no homogeneity amongst young people. And so if you could reflect a little bit, or sort of what are your perspectives on how different segments of adolescents and young people, how they experience vulnerability differently, how that was clear from these studies, and I think most importantly, how that affected your views on the COVID response, on the response that was needed maybe for particular subgroups of adolescents and young people during the pandemic. Go ahead, Guillermo.
Claro, por supuesto yo tengo un claro ejemplo. Por ejemplo, cuando empezaron las clases en línea, que pues todo se digitalizó, el sector de población joven que vive en zonas rurales, en donde hay menos acceso a internet, enfrentaron un gran reto por delante. ¿Cómo entrar a clases si en su comunidad no había internet? Y esto nos dejó ver las desigualdades, porque los jóvenes en zonas urbanas, o que contaban con una computadora en casa, pues fue relativamente sencillo, entre comillas, también porque fue una complejidad bastante grande. O también nos dejó ver cómo las juventudes indígenas, que históricamente han sido invisibilizadas, enfrentaron con mayor fuerza estos cambios tan bruscos, porque al haber tanto, el gobierno federal lo que hizo para poder responder a la situación fue sostener los programas para ayudar a salir adelante de esta situación, pero también nos dejó ver cómo muchas veces el territorio o en donde uno radica incide muchísimo en el ejercicio de nuestros derechos, y eso hay que terminarlo. Justo creo que el reto es que en todo el territorio nacional las personas puedan ejercer todos sus derechos. Creo que es un planteamiento central. O también lo que mencionaba respecto al aislamiento, hay personas que vivían hacinadas prácticamente en un departamento de 4x4, en donde vivían 5 personas. Y esto, si le sumas que es 24/7, de estar todo el tiempo juntos, pues generó muchos problemas, mucho estrés. En cambio, aquellos jóvenes que tenían una casa con un cuarto propio, pues tenían privacidad, tenían la manera de llevar un poco mejor la pandemia, ¿no? Entonces, justo yo creo que cuando hablamos de las diversidades, o sea, es entender desde que las juventudes no solamente son las juventudes universitarias de clase media que viven en las zonas urbanas, sino son todas las y los jóvenes de la diversidad sexual, las y los jóvenes indígenas, las jóvenes mujeres, las y los jóvenes obreros, las y los jóvenes estudiantes. Es decir, poder comprender y tener esta empatía y sensibilidad para comprender cómo es que están desarrollando sus juventudes a partir de sus entornos.
Thank you. And maybe over to you, Julie, for a final word.
No, I couldn't say it better than Guillermo said it, because I think that was the same things we were seeing in Kenya. And in Kenya, sort of you'd see perhaps issues of maybe early marriage in one part of the country, more issues of transactional sex, more high on the other end. So with different parts of the country, we'd see other vulnerabilities, that were unique to the different settings. And I just have, I think last week I was out in part of Kenya, it's called Kajiado, and I was out there and I was looking at, there were basically highlighting the strength they have on the digital learning and how they've been able to trying to build back stronger. And I was very inspired to see, online learning and the kids in rural areas now being able to sort of learn and getting data and sort of try to keep up with their learning. But when the bell rang at lunchtime, it was about 12:30 when the bell rang, it was and everyone, no one was moving. And I asked, are you not going for lunch? And they said to me, we don't have lunch, we don't have food. And for me, that really struck me as why we're doing what we're doing, because we sort of cannot continue working on trying to fix only our areas of work. And we need to sort of look at the adolescent as a whole. We can give her education or sexual reproductive health content, but if she's not eating or we're not looking at her mental health, then we're sort of still doing her injustice. So how do we get to a place where we are sort of putting our efforts together, working together, and actually sort of looking at her as a whole instead of different body parts? So I think that has been something that I hope that we can continue in all our areas of work to be able to look at her adolescents as a whole. And as we continue programming and bringing our colleagues on board in our programming and every approach that we put forward.
Thank you so much, Julie and Guillermo. So we're just wrapping up. This hour and a half has, at least for me, flown by really quickly. So just a few, key takeaway, I think some themes that have really come through. So a lot about inequalities and diversity, even amongst adolescents and young people, and how we really need to be cognizant that we have the data to illuminate those differences, and so that we are aware of them and are able to respond accordingly. Another point is really sort of the importance of good relationships between government and researchers, so that the generation and use of evidence is really a partnership. And perhaps even, that researchers need to be pushed to make sure that they are not only sort of engaged in those types of relationships, but really packaging their data and information in ways that are possibly out of the box to make sure that government partners and other users of evidence can engage with that information. And I think we've seen two really great examples of a government researcher partnership here. So I want to thank again all of our panelists and presenters, and to our whole audience for joining today. We invite you to explore the two reports that have come out so far, Promises to Keep from Kenya and the VOSIS 19 report from their first round of data collection. The links are in the chat. And we also invite you, if you're interested, if you're not already a member or don't receive it, to register for the Girl Center newsletter, so you can be up to date of future webinars like this, our newsletter, other data sort of resources that are available as we continue this work of really trying to see data into action. And again, in a few days, I think we will follow up with everybody who registered for the event, and we can share the slides and a recording. So with that, thank you everyone so much for joining us, and have a really great rest of your day. Goodbye.